everybody. Welcome to Focus on Framingham. I'm your host, Mike Cunningham, and I'm sorry that I've been gone for about a year. I've just been very busy with other projects going on, but there's a lot going on in the news here in Framingham, and I thought I'd bring the show back. I first want to also mention that if you're watching me online, you can check us out also on on TV and on RCN now on channel 1100. You can watch Access Framingham in full high definition, and they have the program listing, so you actually know what's on TV and when. You can set it to record. You can do a season pass and all that. That's only available on RCN. Hopefully, the other cable providers will follow along shortly. So obviously, based on my background graphic there, my main topic of today's show is going to be the coronavirus, or COVID-19, and how it has drastically changed things here in Framingham. And I thought that I would do a series of different shows on this. This first show that I'm recording on March 18th, hopefully you'll be seeing this soon on TV, and this show, I just kind of wanted to give a background of how we got here, the various communications that came out from the city and other places, and maybe some at the end. I'll have some resources that have appeared online to help with this. So, starting back on February 26th, an email was sent out from the school system, from Dr. Tremblay, and it read, "Dear Framingham families, this week the U.S. Centers of Disease Control and Prevention predicted widespread local transmission of coronavirus disease 2019, COVID-19, in the United States, mentioning schools, businesses, healthcare systems, and raising concerns about how we plan and manage an outbreak." And then there was some more information in that. The next item that came out was on March 3rd. The city sent out an email. This is like a press release saying that while Massachusetts continues to prepare for the potential outbreak of the novel virus, the risk of COVID-19 in the Commonwealth is low. In contrast, the flu is high. To date, there have been one confirmed and one presumptive case of COVID-19 in Massachusetts. There's been more than 30,000 cases of the flu. Then on March 5th, Dr. Tremblay sent out another notice saying, first, it's important to emphasize that at this point there's no significant risk to the Framingham public school community relative to COVID-19. Nonetheless, district leaders have convened discussions and planning for a coordinated response in the event that the risk to the community increases. District plans will be developed in accordance with the latest guidance from the Framingham Board of Health, the Massachusetts Department of Public Health, and the Centers for Disease Control and Prevention. So then on March 11th, another email came out. I believe this also came out from the school department. Dear Framingham community, shortly after school began this morning, Dr. Sam Wong, Director of Public Health for the City of Framingham, and I learned that a Framingham resident received a presumptive positive test for the result of COVID-19, and this individual has a child who attends Potter Road Elementary School. This child presented this morning mild symptoms of an infection in response to this information. So this was March 11th. Now, I want to add that I believe that the child has since not shown any symptoms, has been asymptomatic, but I'm not 100% sure on that. Access Framingham on March 13th. Dear members and friends, in light of the recent COVID-19 outbreak, with an abundance of caution, Access Framingham is closing all member services until March 23rd, 2020. The Parks and Recreation Department, also on the 13th. Dear registrants, effective Friday, March 13th, all Framingham Parks and Recreation programs, classes, and events will be suspended through Sunday, March 29th. And then also on the 13th, Bob Tremblay sent out another note saying, "Good afternoon. In collaboration with Mayor Spicer, the health department, and school union leaders, Framingham Public Schools, school buildings, and offices will be closed for 2 weeks through March 29th, 2020, due to the recent concerns over COVID-19. The City of Framingham is working with community partners to provide information to families about access to free food resources. A more detailed message will be forthcoming, which will include additional resources for family and information for all staff. We'll reassess the situation on a continuous basis and will be updating you regularly. City press release on March 13th. Framingham today, the City of Framingham and the Framingham Public Schools announced that effective Friday, March 13th through the Sunday, March 29th, the city's library, Callahan Center, and Loring Arena will be closed to the public, and all Framingham public schools will be closed for a minimum of 2 weeks to help minimize the spread of COVID-19. All activities from the city's Park and Recreation Department will be canceled for the same time frame. Registration fees for these activities will be refunded. The city will reassess if the closure needs to continue beyond 2 weeks. And then another press release. This was on the 14th now. Framingham COVID-19 update. City of Framingham receives notification that a second resident tests positive for COVID-19. Then they note that in Massachusetts, resources for COVID-19 information, you can dial 211 from any cell phone or landline. And they go on to mention that the second resident tests positive for COVID-19. The City of Framingham was informed that a second resident has tested positive for the virus. The resident, who was a household member of the first resident who tested positive for the virus, has been in quarantine since March 11th, 2020. Those potentially exposed to the newly diagnosed resident have been traced and contacted. They are now in quarantine. I believe that this individual, this household, was related to the Biogen outbreak that happened in late February. Then again on March 14th, Framingham Public Schools, beginning on Wednesday, March 18th, which is today, the Framingham Public School Department of Food Services will prepare grab-and-go breakfasts and lunches for students. Families will be able to drive up to the schools noted below, and where they will be met by a member of the food service team. Walk-ups are welcome. Each school-age child that is present will receive one lunch for the day and one breakfast for the next morning per visit. And it's all school-aged children. The days of operation are going to be Monday through Friday, 10 a.m. to 1 p.m. And the contact information is at 508-626-9109. I unfortunately don't have a list of the schools, but they're readily available if you just search for it on either the City of Framingham or on the school's main website. If you just Google that, you should be able to find I believe it's like 4 schools, Cameron, Barberry, and 2 others that are serving the lunches. Eversource sent out a notice to all their customers that they're curtailing any non-essential planned electric outages, continuing to plan for brief and targeted electric outages only when they are required to perform critical work to ensure reliability, making sure all of our field resources and support staff continue to be at the ready in the event of a storm or other similar disruption not related to COVID-19. DPW sent out a statement. DPW building closures. I believe this was also over the weekend. Framingham MA, as of Tuesday, March 17th, 2020, public works buildings are closed to the public until further notice. What buildings do these include? Public Works Operations Building at the 100 Western Ave, the Capital Projects at 110 Western Ave, the Recycling Drop-Off Center at 255 Mount Waite Avenue, and the Public Works Administration at 150 Concord Street, room 213. Weekly trash and recycling collection will continue as usual. Bulky item collection is temporarily suspended. If you have extenuating circumstances regarding this change, please reach out to the Sanitation Division. I also wanted to mention, there's a Facebook page called the Framingham Coronavirus Community Outreach. And if you are not on Facebook, you can still read it. It's a public group. And what they've been doing is just sharing information on many different things regarding the, especially food and supplies within Framingham. Sometimes people will update and share information on whether or not a store is open and has food, toilet paper, cleaning wipes, things like that. They'll share information about the senior shopping hours that a lot of stores are starting to do. Market Basket, I'm reading here, is starting March 19th. Market Basket will limit the, I believe it's probably the first hour of their store. 5:30 a.m. to 7 a.m. The store will be open only to serve customers 60 and older. Stop and Shop has done the similar thing. The hours, I believe, are a little different. I believe it's the first hour is for 60 and up. So yeah, that kind of brings us up to the middle of the show here. I'm going to show a PSA, and we'll be back in a minute. So stay tuned. All right, I'm back. Yeah, so I'm a little rusty at doing the show. I haven't done this in like a year. But here's Maria Robinson tweeted out a graphic for information about COVID-19 resources. I'll leave this up just for a minute here. A lot of people have been providing a lot of information about various resources. Let's see. So that's the what Maria provided. Unemployment assistance, small business information, health services, and food access here in Framingham. Catherine Clark actually held a town hall, kind of a tele-remote town hall. I think yesterday. I have information on it here in a second here. Let's see. She had a town hall on Tuesday, March 17th at 6:30. She was joined by infectious disease physician Dr. Nahid Badlia and the National Security Analyst Juliet Kaiman. And I guess they had questions about that. You can probably find that online. Another email that came out on the 17th was the Board of Health to limit in-person public meetings through March 31st as they received the notification that a fourth resident had tested positive for COVID-19. The fourth Framingham resident tested positive for COVID-19. The city was informed that the fourth resident was tested positive for the virus. The resident who is not related to the Framingham's previous positive cases, recently traveled to Europe and lives with another adult. The person is currently in isolation at home. Framingham Board of Health limits in-person meetings. Last night, the Board of Health met to discuss the parameters around COVID-19 steps we need to take as a community. And I cut the rest of that off. The Board of Health has the responsibility to maintain the public's health. In Framingham, the board voted unanimously to limit in-person meetings, except for the city council, and use technology solutions set up by Framingham's IT department to continue remote meetings. COVID-19 in Framingham, information about the actions of the city and the schools are taking, along with more information on COVID-19 and prevention measures, can be found at www.framingham.gov/2875/coronavirus-COVID-19. That's a little bit of a tricky URL, which is updated frequently. As the city receives additional information, residents can find updates on the website, Facebook, and Twitter at Framingham_MA on Twitter. If there's an urgent update, the city will employ the city's Alert Framingham system, otherwise known as Reverse 911. To sign up for the city's Reverse 911 system, please go here, www.smart911.com. I'd actually encourage people to use that in general anyways. Home Depot's store hours starting March 19th. They're going to start closing at 6 p.m. The opening hours will remain unchanged. And I just kind of wanted to wrap up the show with some information, and this is a little bit scary to digest. So I'm going to do my best here. This is Dr. Jeremy C. Young. He wrote recently about some modeling that they've done at the Imperial College team. I think this is in the UK. About the coronavirus, and I'll just read a little bit here. We can now read the Imperial College report on COVID-19 that led us to the extreme measures we've seen in the U.S. this week. Read it. It's terrifying. I'll offer you a summary in the thread. The Imperial College team plugged infection and death rates from China, Korea, Italy into epidemic modeling software and ran a simulation. What happens if the U.S. does absolutely nothing, if we treat COVID-19 like the flu, go about business, and let the virus take its course? Here's what would happen. 80% of Americans would get the disease. 0.9% of them would die. Between 4 and 8% of all Americans over the age of 70 would die. 2.2 million Americans would die from the virus itself. It gets worse. People with severe COVID-19 need to be put on ventilators. 50% of those ventilators on ventilators will still die, but the other 50% live. But in an unmitigated epidemic, the need for ventilators would be 30 times the number available in the U.S. Nearly 100% of these patients die. So the actual death from the virus would be closer to 4 million Americans in a span of 3 months. 8 to 15% of all Americans over 70 would die. How many is 4 million people? It's more Americans than have died all at once from anything ever. It's the population of Los Angeles. It's 4 times the number of Americans who died in the Civil War. On both sides combined, it's 2/3 as many people that died in the Holocaust. Americans make up 4.4% of the world's population. If we extrapolate these numbers to the rest of the world, warning, there's a margin of error is high here, that gives us 90% million deaths globally from COVID-19 in 3 to 6 months. 15 Holocausts, 1.5 times as many people that died in all of World War II. Now, of course, countries won't stand by and do nothing. So the Imperial College team ran the numbers again, this time assuming a mitigation strategy. All symptomatic cases in the U.S. in isolation. Families of these cases quarantined. All Americans over 70. Social distancing. This mitigation strategy is what you've been seeing a lot of people talk about when they say we should flatten the curve, try to slow the spread of the disease and people most likely to die from it to avoid overwhelming hospitals. And it does flatten the curve, but not nearly enough. The death rate from the disease is cut in half, but still kills 1.1 million Americans all by itself. The peak need for ventilators falls by 2/3, but it still exceeds the number of ventilators in the U.S. by 8 times. This leaves the actual death toll in the U.S. right around 2 million deaths. The population of Houston, 2 civil wars, 1/3 of the Holocaust. Globally, 45 million people will die, 7.5 Holocausts, 3/4 of World War II. That's what happens if we rely on mitigation and common sense. Finally, the Empirical College ran the numbers again, assuming suppression strategy. Suppression strategy, isolate symptomatic cases, quarantine the family members, social distancing for the whole population, all public gatherings, most workplaces shut down, schools and universities close. Suppression works. The death rate in the U.S. peaks 3 weeks from now, and that's now as of March 17th. The death rate peaks 3 weeks from now at a few thousand deaths, then goes down. We hit but don't exceed the number of available ventilators. The nightmarish death toll from the rest of the study disappears. But here's the catch. If we ever relax the suppression before a vaccine is administered to the entire population, COVID-19 comes right back and kills millions of Americans within a few months, the same as before. After the first suppression period ends in July, we could possibly lift restrictions for a month, followed by 2 more months of suppression and repeating pattern without triggering an outbreak or overwhelming the ventilator supply. Staggering breaks by city could do it a bit better, but we simply cannot allow the virus to spread throughout the entire population in the way the other viruses do, because it's just too deadly. If lots of people we know end up getting COVID-19, it means millions of Americans are dying. It simply cannot be allowed to happen. How quickly will a vaccine be here? Last week, 3 separate research teams announced they had developed vaccines. Yesterday, one of them, with FDA approval, injected the vaccine into a live person without waiting for an animal testing. This is an extreme measure, but necessary. Now, though they have to monitor the test subject for 14 months to make sure the vaccine is safe, that part can't be rushed. If you're going to inoculate all humans, you have to make absolutely sure the vaccine itself won't kill them. It probably won't, but you have to be sure. Assuming the vaccine is safe and effective, it will take several months to produce even enough to inoculate the global population. For this reason, the Empirical College team estimated it will be about 18 months until the vaccine is available. During these 18 months, things are going to be difficult and very scary. Our economy and society will be disrupted in profound ways. And if suppression actually works, it will feel like we're doing this all for nothing, because infection and death rates will remain low. It's easy to get people to come together on a common sacrifice in the middle of a war. It's very hard to get them to do so in a pandemic that looks invisible, precisely because suppression methods are working. But that's exactly what we're going to have to do. And again, this was Jeremy C. Young. He's an assistant professor of history. Sorry, I said that he was a doctor. He's an assistant professor of history at Dixie State, director of DSU Politics, author of The Age of Charisma. So if you want to read more, you can check him out on Twitter, Jeremy C. Young. So that kind of wraps up all the information that I had for this episode. I hope that people found it somewhat useful. This is kind of a period in, I think, everybody's life where all the days are probably going to start to blur together. They certainly are for me. And I'm going to kind of use this show a little bit as kind of like a video log, to just kind of track where we go day by day. Access Framingham, I believe, will be airing this episode pretty soon after I record it, and I hope to keep new episodes coming at least weekly. because there's just so much going on in our city. I actually haven't been out of my house for about 4 days. We haven't had the urgent need to, and I just felt that it was safe. We did get Chinese takeout. I felt that it was important to really try to support local businesses in this time because they're really, really struggling. And there's really no reason why not to, you take basic precautions, obviously, when you go out. But to, if you're going to get takeout, certainly there's many businesses in town still offering takeout only service. The Framingham Coronavirus Community Outreach Group shares information about different restaurants that are providing this, what their hours are, and where you can order and things like that. So I'll try to keep new episodes coming. I hope that that this was informative, and as new information comes out, I'm going to make new shows and provide it. So anyways, that's the show for today. Thanks for watching, and I'll see you next time.